Hello, good evening dear students. Welcome back to my channel. I hope you have all enjoyed studying for NEET MDS examinations. So here is a quick revision for general pathology and microbiology. So here are some important questions which we ask for your exams. So all the best and let's begin. Liquefaction necrosis is seen in brain, lung, liver or spleen. So coming to the discussion part. So, which are the types of necrosis? Coagulatory necrosis, liquefactive or colliquatory necrosis, fat necrosis, fibrinoid and caseous necrosis. So, first one is the coagulatory necrosis. From in which organs the coagulatory necrosis is seen? Here, the coagulatory necrosis is seen in heart, spleen and kidney. So, these are the various organs here coagulatory necrosis happen. Then liquefactive or colliquatory necrosis is seen in brain and abscess cavity. Then fat necrosis is seen in pancreas and breast. Then fibrinoid necrosis is seen in arterioles, in hypertension, peptic ulcer. Okay, then caseous necrosis is seen in tuberculosis. So these are the various types of necrosis. Which are they? So coagulatory necrosis is seen in heart, spleen and kidney. The liquefactive or colliquatory necrosis is seen in brain, abscess cavity. So here the brain is very important. It is frequently asked question. Okay, that is liquefactive. Other name is colliquative, not coagulative. So there is one misunderstanding that the coagulative and colliquative is same. Okay, so it is not correct. Liquefactive or colliquative is same. So liquefactive necrosis is seen in brain, abscess cavity. Coagulative necrosis is seen in heart, spleen and kidney. And fat necrosis, pancreas and breast. Fibrinoid necrosis, arterioles and hypertension, peptic ulcer. Then caseous necrosis is seen in the central foci of infection of tuberculosis. Okay. So the correct answer is brain. So liquefaction necrosis is seen in brain. Okay. Coming to the next question. Actions of bradykinin include all of the following except. So what are the actions of bradykinin? And except which is the function. So that is the actions are bronchodilation, vasodilation, increased vascular permeability or cleavage. So which action is not of bradykinin? So what are the functions of bradykinin? So the main functions are smooth muscle contraction, vasodilation, pain, then increased vascular permeability. So these are the various functions of bradykinin. So the answer is bronchodilation. It is not a function of bradykinin. So all others are functions of or actions of bradykinin. Okay. Dominant cell plays role in chronic inflammation. Is it a plasma cell or lymphocyte or macrophage or eosinophil? So there are two types of inflammation. Which are they? First one is the acute inflammation and then chronic inflammation. So in acute inflammation, neutrophils comprises the first line of body defense, followed later by monocytes and macrophages. Whereas in chronic inflammation, phagocytes, that is circulating monocytes, tissue macrophages, then lymphocytes, and plasma cells. And also the macrophages comprise the most important cells in chronic inflammation. So, coming to the question, the dominant cell plays role in chronic inflammation is it plasma cell or lymphocyte or macrophage or eosinophil? So, in chronic inflammation, the dominant cell plays a role is macrophage, whereas in acute inflammation, it is neutrophils. Okay. Early positive cell reaction in Lepromin test is it Fernandez reaction, Mitsuda reaction, Wassermann reaction, or none of the above? So, this is the Lepromin test. So, this is the Lepromin test. Actually, this test involves intradermal injection of Lepromin. It's an antigenic extract of M. leprae, that is Mycobacterium leprae. So, this is the Lepromin test. And here it is an antigenic. Lepromin is an antigenic extract of Mycobacterium leprae. But it is not a diagnostic test. Okay. And it is used for classifying leprosy on the basis of immune response. And this test reveals delayed hypersensitivity reaction in the patients of tuberculoid leprosy, and for lepromatous leprosy, it is negative by the test. And what is Fernandez reaction and Matsuda reaction? So first one is the Fernandez reaction. What is it? Actually, the Fernandez reaction is early positive reaction in 24 to 48 hours. So early reaction is Fernandez reaction. And the Mitsuda reaction, what is Mitsuda reaction? Mitsuda reaction is the delayed reaction. So this is the Mitsuda reaction, and this is the delayed granulomatous lesion appearing after 3 to 4 weeks. So it is the early reaction is Fernandez. Okay, so EF. Early reaction is Fernandez and delayed is Mitsuda reaction. So the early positive cell reaction in Lepromin test is Fernandez reaction. Then, what are toll-like receptors and what are expressed? These are expressed by macrophages, epithelial cells, fibroblasts, and all of the above. Actually, these toll-like receptors are family of transmembrane proteins which act as a pattern in recognition receptors, which play a crucial role in innate immune system by recognizing pathogen-associated molecular patterns and triggering immune responses. So, these are the toll-like receptors, and they are family of transmembrane proteins. And these are expressed by all of the above, that is macrophages, epithelial cells, and fibroblasts. Coming to the next question. Samoma bodies associated with. Is it a metastatic calcification or dystrophic calcification or apoptosis or necrosis? So, the Samoma bodies, what are they? They are round microscopic calcific collections, and they are form of dystrophic calcification and also for feature of papillary carcinoma. So, there is a mnemonic. That is the PSM square. That is P for papillary carcinoma, prolactinoma, S for somatostatinoma, serous ovarian tumor, then mesothelioma and meningioma. So, what is dystrophic calcification? Actually, this refers to the deposition of calcium salts in damaged or necrotic tissues. So, there is a mnemonic also, that is B for D. That is dystrophic calcification refers to the deposition of calcium salts in damaged or necrotic tissues, occurring despite normal calcium and phosphorus levels in the blood, often seen in areas of previous injury or inflammation. So, the metastatic calcification occurs in normal tissues due to elevated serum calcium levels, while dystrophic calcification occurs in damaged or necrotic tissues even with normal calcium levels. So, that is about the dystrophic and metastatic calcification, and the dystrophic calcification is seen in these Samoma bodies. Okay. So, the answer is dystrophic calcification. So the next question, that is, iron is absorbed from duodenum, jejunum, colon, stomach. So this is the dietary iron. Okay, here, and this is the duodenum. So the iron is mainly absorbed in the duodenum, and also some parts of upper parts of jejunum also, but primarily in duodenum. Okay, so iron is absorbed from duodenum, which is not an anti-inflammatory cytokine. Is it IL-13 or 10 or 18 or TGF beta? So, which are the main cytokines? That is inflammatory or pro-inflammatory cytokine and anti-inflammatory cytokine. So, which are the inflammatory or pro-inflammatory cytokine and anti-inflammatory cytokines? Let's discuss. So, what are these inflammatory cytokines? These are actually type of signaling molecule that is excreted from immune cells like helper T cells and macrophages, and certain other cell types that promote inflammation. And the interleukins are interleukin 1, then interleukin 12, then 18, then tumor necrosis factor, interferon gamma, and granulocyte macrophage colony stimulating factor. And anti-inflammatory cytokines are interleukin 4, interleukin 10, 13, IFN alpha, and transforming growth factor beta. So these are the various cytokines. So the not an anti-inflammatory cytokine, so which is a pro or inflammatory cytokine, that is interleukin 18. So next question is, Crydo-Chat syndrome involves chromosome number 13 or 18 or 22 or 5. So what is Crydo-Chat syndrome? This is actually a rare genetic disorder, and it is characterized by distinct cry in infants. And this cry is known as cry of the cat. That is, in French, it is cry du chat. Okay, so cry of the cat. So the characteristic cry in infants resembling that of a cat, which gives the syndrome its name cry du chat. And this condition is caused by deletion of genetic material on the short arm of chromosome number 5. So, it is otherwise known as chromosome 5p deletion syndrome or 5p minus syndrome or Lejeune syndrome. And this missing genetic material leads to various developmental and intellectual disabilities. And this is often diagnosed based on certain clinical features, including the distinctive cry, facial characteristics, and developmental disturbances. So confirmation is done through genetic testing. So the Crydo-Chat syndrome, it involves the chromosome number 5. Kupffer cells are seen in liver, spleen, lung, or heart. Actually, the Kupffer cells are seen in liver. So liver macrophages is known as Kupffer cells. So next question, Auer rods is seen in which AML? Is it M0, M3, M5 or M7? So what are these Auer rods? Actually, these are hallmark of acute myeloid leukemia, that is AML. Okay, and these are the elongated structures. These are the elongated structures seen in the malignant cells of neutrophil lineage, mostly in myeloblast, and they are linear groupings of primary astrophilic granules. That is known as Auer rods. Okay. So the French, American, British classification of AML, it is from M0 to M7. What is M0? It is minimally differentiated. M1, acute myeloblastic leukemia with minimal maturation. M2, acute myeloblastic leukemia or AML with maturation. Then M3 is acute promyelocytic leukemia. So in M2 and M3, the Auer rods are seen. Then Acute myelomonocytic leukemia, presence of both myoblast and monoblast. Acute monocytic leukemia, that is M5. Then M6, acute erythroid leukemia, and M7, it is acute megakardioblastic leukemia, and most common AML seen in Down syndrome, that is M7. So M2 and M3, the all roads are seen. So from the options, all roads are seen in M3 and also M2. Okay. M2 and M3, the all roads are seen. And in M7, the most common AML seen in Down syndrome. Okay. Then M5, it is tissue infiltration and organomegaly, and M0 is minimally differentiated. What is Opisthotonus and where it is seen? Tetanus, anthracis, or tetany or rabies. So the tetanus, here it is a contaminated wound, and the Clostridium tetani bacteria, this is the tetanus neurotoxin, and this is known as Opisthotonus, that is severe hyperextension and spasticity caused by neurotoxin of Clostridium tetani. And Opisthotonus is a posture where the body is arched backward with the head and neck thrown back and the tongue lifted off from the ground. This position is known as Opisthotonus, and this is seen in tetanus. So the Opisthotonus is seen in tetanus. Chickenware appearance of enlarged bone marrow spaces is seen in fetal alcohol syndrome or sickle cell anemia or hemophilia A or beta-thalassemia major. So in beta-thalassemia, especially major forms, chicken wire pattern or on radiographs of facial bones due to enlarged marrow spaces and altered trabecular bone is a characteristic radiographic finding. And it is a genetic disorder that affects the body's ability to produce hemoglobin, a protein in red blood cell that carries oxygen. And why this chicken wire pattern? Because of the bone marrow becomes hyperactive to compensate for lack of red blood cells, leading to expansion of marrow spaces and changes in the trabecular structure. And the chicken wire pattern characterized by coarsening of some trabecula and blurring or disappearance of others is seen in the facial bones. So the chicken wire appearance of enlarged bone marrow spaces is seen in beta thalassemia major. Presence of Heinz bodies in erythrocytes indicates malarial infection, hemoglobin abnormalities, oxidative stress, or degraded bacterial forms. Which are the, or what are these Heinz bodies? Heinz bodies are actually small dots in RBC. These are the Heinz bodies. Okay, these are the Heinz bodies. That is small dots in red blood cells, which indicate oxidative damage to the cells. So it indicates mainly oxidative stress, and they are made of hemoglobin, a protein in red blood cells. Heinz bodies can be a sign of certain medical conditions like anemia. So the presence of Heinz bodies indicates oxidative stress. And then coming to the DiGeorge syndrome, what is it? It is due to is it due to congenital thymic aplasia or deficiency of complement factors or inborn error of metabolism or chromosomal anomaly? It is actually a genetic disorder of chromosome number 22, that is DiGeorge syndrome. Which are the or what are the features? Slanted eyes, short philtrum and small mouth. In immune deficiency, then epilepsy, abnormal facial shape, low intelligence, cleft lip and palate, and heart problems. So, a mnemonic is catch 22. That is C for cardiac abnormalities, A for abnormal facies, T for thymic aplasia, cleft palate, hypocalcemia, and 22 chromosome number 22 is affected. There is deletion of it. Okay, so DiGeorge syndrome, catch 22. And it is due to congenital thymic aplasia. Next question, Prader-Willi syndrome is caused by loss of functions of genes in a particular region of chromosome number 5, 10, 15 or 20. What is Prader-Willi syndrome? And the Prader-Willi features are a mnemonic, that is the H3O. What is H3O? Hyperphagia, hypotonia and hypopigmentation are the three features of this Prader-Willi syndrome, and also obesity. So here these are the Prader-Willi features, and also railroad track years are also a feature of this Prader-Willi syndrome. And it is caused by loss of function of genes in a particular region of chromosome number 50. Breast cancers due to BRCA gene, number 1 gene mutation have incidence of 25%, 40%, 60% or 80%. So what is the BRCA1? Okay, this is a gene and it causes breast cancer. BRCA1 and have incidence of. So the breast cancers due to BRCA1 gene mutation have incidence of 80%. And BRCA means breast cancer. Okay. So these genes are the best non-genes linked to breast cancer risk. And women with inherited BRCA1 have a lifetime risk of 65 to 80% of developing breast cancer, while BRCA2 mutation carriers have lifetime risk of 45 to 80%. So the mother transfer disease to all her children is an example of X-linked dominant or recessive or mitochondrial or autosomal dominant. So a mother transfer disease to all her children is an example of mitochondrial. And the mitochondrial genetic disorders can be caused by changes or mutations in either mitochondrial DNA or nuclear DNA, lead to dysfunction of the mitochondria and inadequate production of energy. And it is an example of non-Mendelian inheritance pattern. And these are transmitted by maternal inheritance. Okay, mitochondrial DNA that is transmitted by maternal inheritance. So M for M, mitochondrial maternal inheritance. Okay. And then next question is Kveim's test is diagnostic test for actinomycosis, diphtheria, tuberculosis or sarcoidosis. Actually, it is a skin test and it is used to detect sarcoidosis, where part of a spleen from a patient with non-sarcoidosis is injected into the skin of patient suspected to have a disease. If non-caseating granulomas are found, the test is positive, and if the patient has been on treatment, example glucocorticoids, test may return a false negative result. Test is not commonly performed in UK. No substrate has been available since 1996, and there is a concern that certain infections such as bovine spongiform encephalopathy could be transferred through Kveim test. So Kveim test, it is a skin test and it is used to detect sarcoidosis, and here part of spleen from a patient with non-sarcoidosis is injected into skin of a patient suspected to have a disease. That is known as Kveim test or Nickerson Kveim or Kveim Silsback test. So the answer is sarcoidosis. Which one of the following statement is not part of Koch's postulates? Microorganism must be isolated from a dead animal and pure culture. Microorganism and disease can be identified from a mixed culture. Pure cultured organism is inoculated into a healthy, susceptible animal, and same microorganism must be present in every case of the disease. So, which are the Koch postulates? This is the Robert Koch. He proposed Koch's postulates. Okay. So the microorganism must be found in abundance in all organisms suffering from disease, but should not be found in healthy organisms. Then the microorganism must be isolated from diseased organism and grown in pure culture. The cultured microorganism should cause disease when introduced into a healthy organism, and microorganism must be re-isolated from the inoculated disease experimental host and identified as being identical to the original specific causative agent. So these are the Koch's postulates. So the options are microorganism must be isolated from dead animal and pure cultured. The pure cultured organism is inoculated into a healthy susceptible animal. The same microorganism must be present in every case of the disease, and the exception is that the microorganism and disease can be identified from a mixed culture, and this is not a part of Koch's postulate. H antigen is shown by, is it flagella or teichoic acid or LPS or all of them? So answer is flagella. Toxin production and sporulation is associated to which phase in bacterial growth curve? Log phase, stationary phase, decline phase, or lag phase. So the bacterial growth curve, it consists of various phases. This is the number of bacteria and this is the time. So first one is the lag phase. Then in log or exponential phase. So it is known as log phase. Then another one is the rest phase, or it is known as stationary phase. And finally the death phase. So this is a declining phase. Okay. So this is known as death phase. So these are the various phases, which are the lag phase, log phase, stationary phase, and death phase. So the toxin production and sporulation is associated to stationary phase of bacterial growth curve. Coming to next question, multiple drug resistance of bacteria depends on which of the following factors? Is it RTF, that is resistance transfer factor, then call factor, or F factor, or all of the above? So bacterial multiple drug resistance is often linked to the presence and transfer of resistance plasmids. It's also known as R factor, which carry genes conferring resistance to multiple antibiotics. So its answer is RTF. LG medium is used for. Is it tuberculous bacillus or salmonella or shigella or brucellosis? So answer is tuberculous bacillus. So this is the LJ medium, or otherwise known as Lowenstein-Jensen medium. It is a selective culture medium used primarily for cultivating and isolating Mycobacterium species, particularly Mycobacterium tuberculosis. So this is the LJ medium, and this is so answer is tuberculosis. IgE in type 1 hypersensitivity is produced by, is it mast cells or eosinophils or basophils or none of the above? So IgE is produced by plasma cells located in the lymph nodes, draining the site of antigen entry or locally at the sites of allergic reactions. So the IgE is produced by not mast cell or eosinophil or basophil. So answer is none of the above. The answer is plasma cells. Cytokine involved in activation of eosinophils in type 1 hypersensitivity is interleukin 1, 4, 5 or none. So answer is interleukin 5. So interleukin 5 is involved in the activation of eosinophils in type 1 hypersensitivity. Antigen combining site of the antibody is it idiotope or paratope or epitope or hapten? So this is the antigen and this is the antibody. Okay, this is the antigen and this is the antibody. So here epitope is seen in antigen and the paratope is in antibody. So paratopes and epitopes are unique binding regions of antibody and antigen respectively. More specifically, antigens known to contain specific antigenic determinants which are called epitopes, and antibodies contain antigen binding sites are known as paratopes. So the antigen combining site of the antibody is known as paratope, and the antigen combining site of the antigen itself is known as epitope. Okay. Blood Loeffler's bacilli is it TB or current bacterial diphtheria or N gonorrhea or B anthrax? So this is the Klebsiella bacillus. It is also known as Korean bacterium diphtheria, and the bacterium which causes diphtheria and which was discovered by German bacteriologists Edwin Klebs and Friedrich Loeffler. So this is the Korean bacterium diphtheria, and it is known as Klebsiella bacillus. Ramstic appearance is associated with Clostridium tetani or tertium or perfringens or none of the above. So this is the drumstick appearance and it is associated with Clostridium tetani. First symptom of tetanus infection is lockjaw or rhizus sardonicus or Opisthotonus or position or flaccid paralysis. So the tetanus often begins with the mild spasms in the jaw, that is known as lockjaw. And the spasms also affect your chest, neck, back and abdominal muscles, and the back muscle spasm causes arcing called a Opisthotonus. Sometimes the spasm affects muscles that help with breathing, which can lead to breathing problems also. So the first symptom of tetanus infection is lockjaw. So which of the following is the marker for winter period for hepatitis B infection? IgM anti-HBC or IgG anti-HBC, HBC-AG or anti-HBE-AG. So the window period for the hepatitis B, it refers to the time between the exposure to the virus and which it can be reliably detected in a blood test. Typically 1 to 6 months after exposure, during which neither surface antigen, that is HBsAg, nor the antibody, that is anti-HBs, are detectable. So the time between exposure to hepatitis B virus and the onset of symptoms is called the incubation period, which typically ranges from 30 to 180 days. And during the window period, the virus is present in the body, but neither HBsAg nor anti-HBs are detectable in the blood. And HBsAg is the first serologic marker to appear in the new acute infection, which can be detected as early as 1 week and as late as 9 weeks, with an average of 1 month after exposure to the hepatitis B virus. And anti-HBs, the hepatitis B surface antibody, appears after the HBsAg disappears, indicating recovery and immunity from HBV infection. And IgM anti-HBC, during the window period, the only positive marker is the IgM antibody against hepatitis B core antigen, that is IgM anti-HBC. So the marker for window period for hepatitis B infection is IgM anti-HBC. So that's all for today's lecture, and I hope you have all enjoyed studying for NEET PG examination. So all the very best, dear aspirants, and see you in the next video. Bye for now.